How much does IBD imaging cost? Are you curious about the costs associated with imaging for inflammatory bowel disease? Understanding these expenses can help you plan better if you or a loved one is dealing with this condition. Let's break it down. Inflammatory bowel disease includes conditions like Crohn's disease and ulcerative colitis. Imaging plays a vital role in diagnosing and monitoring these conditions. For individuals with sensitive stomachs or symptoms that overlap with irritable bowel syndrome and colitis, imaging helps doctors see inside the digestive tract. This is essential because symptoms like stomach pain and bloating can be common in both irritable bowel syndrome and inflammatory bowel disease, but the causes and treatments differ. Now let's discuss the costs involved. The price of imaging can vary widely based on the type of test, your location, and your insurance coverage. Studies show that the costs for imaging in patients diagnosed with inflammatory bowel disease are generally higher than for those without the condition. In fact, in the years leading up to a diagnosis, individuals often incur higher imaging costs compared to others. After diagnosis, these costs can peak in the first year and then decrease as treatment stabilizes. Here's what you can expect in terms of specific costs. Endoscopy procedures, which include colonoscopy and upper endoscopy, can range from a few hundred to several $1,000s. The exact price depends on the facility and whether sedation is used. For those with sensitive stomachs, sedation is often recommended to ensure comfort during the procedure. Radiologic imaging, such as computed tomography scans and magnetic resonance imaging, tends to be more expensive than X-rays. A single computed tomography scan or magnetic resonance imaging can cost anywhere from several hundred to a few $1,000s, depending on the provider and insurance coverage. When it comes to insurance, you may have to pay a copay, which could be around $30 or more, or a percentage of the total cost. If you do not have insurance, you will be responsible for the full price, which can be a significant financial burden. For individuals experiencing symptoms like ongoing stomach pain or changes in bowel habits, it is important to know that imaging is not always the first step. Doctors often start with less invasive tests, such as blood work or stool samples. However, if symptoms are severe or persistent, imaging becomes necessary to look for inflammation or damage in the intestines. In summary, the cost of imaging for inflammatory bowel disease depends on the type of test, your location, and your insurance. For those with sensitive stomachs or symptoms that could be irritable bowel syndrome or colitis, imaging is a key tool for accurate diagnosis and treatment. While costs can be high, especially in the first year after diagnosis, insurance and payment plans can help make these tests more manageable. If you have symptoms like stomach pain or bloating, consult your doctor to determine if imaging is needed.